Greetings, everyone. First, I would like to thank the organizers for inviting me to speak at this Global Health Catalyst Summit, which is an important platform for catalyzing collaborations to advance global health equity. I was hoping to attend in person, but unfortunately, I couldn't make it because of other commitments. I would like to acknowledge the presence of His Excellency Ambassador Dr. Sleshi Bakala, Ethiopia's ambassador to the United States, directors of the Global Health Summit, Drs. Wills Enwa, Stefan Avery, and Saiful Haq. It's also my privilege to thank Dr. Akila Viswanathan, Director of Radiation Oncology and Molecular Radiation Sciences, and Bethlem Floreza, Dosimetry Supervisor and Senior Clinical Dosimetrist at Johns Hopkins University. According to Lancet Oncology Commission for Sub-Saharan Africa, cancer is growing significantly in Africa. It accounts for about 6% of all diseases from non-communicable diseases and is a major public health challenge in Ethiopia. Every year, about 77,500 new cancer cases are registered in Ethiopia, and sadly, only 15% of cancer patients have access to the appropriate care and treatment. In Ethiopia, breast cancer accounts for a third of all cancer types, followed by cervical cancer, which accounts for about 14%. And notably, close to 65% of all types of cancers disproportionately occur among women. And 65 to 70% of cancer patients visit care at a very late stage, resulting in poor treatment outcomes. Poor public as well as providers' awareness, low access to care, and scarce availability of trained cancer healthcare workforce are among the reasons for late presentations. Ethiopia has taken significant strides to address the cancer care gap. A national cancer control strategy has been developed focusing on a continuum of care approach from primary prevention to early detection, diagnosis and treatment, and palliative care. The main implementation milestones include expanding cancer radiotherapy treatment centers from only one for many decades to 7 centers, of which 3 are already operational in the country. And we've also scaled up chemotherapy services to 17 hospitals. Additionally, investing in human resources for cancer care has resulted in increasing the number of hemato-oncologists from only 3 to 4 to currently over 30, plus also over 40 residents who are currently in specialty training. Furthermore, Ethiopia has successfully implemented community-level screening with visual inspection of acetic acid for cervical cancer at unprecedented scale, with over 1,200 public health facilities now providing screening to close to 1 million women aged 30 to 49. And these are combined with over 1,500 cryotherapy and about 300 lip machines available. Public awareness creation has also been a crucial component of cancer control in Ethiopia, using the primary care system. But despite these progresses, we have significant challenges. One is a need for training of specialized cadres of health workforce, such as radiotherapists and medical physicists, which is far behind the pace. Additionally, there is a need to improve radiation treatment equipment maintenance capacity, which requires more biomedical engineers trained and made capable of troubleshooting advanced machines. Advancing the health system to respond to the complex needs of cancer care is also crucial, and this includes the effective supply chain management of cancer medicines and commodities, data capturing, digitization to enhance skill transfer across various levels of care, including the use of telemedicine. And data for cancer is also a significant gap in Ethiopia. Our country does not have a well-established cancer registry system, which is crucial for monitoring and evaluating the effectiveness of cancer control strategies. Diagnostic capacities for targeted treatment and advanced pathology investigation, such as nuclear medicine, PET scan, and mammograms, are suboptimal in the country. These gaps in cancer care in Ethiopia highlight the need for continued and concerted efforts to improve the care and the outcomes. As I mentioned earlier, one of the critical areas is capacity building of human resource, which I hope is a focus of the summit, with priority training areas being radiotherapy technologists, radiation oncologists, medical physicists, pediatric oncologists, hemato-oncologists, oncology nurses, nuclear medicine physicians, radiopharmacists, nuclear medicine physicists, and nuclear medicine imaging technologists. And preventive maintenance capacity, as I mentioned earlier, is also a crucial area of engagement. And information technology, including cancer registry research and evidence generation, are also methods to improve the quality and effectiveness of cancer care in Ethiopia. Expanding chemotherapy services, strengthening diagnostic services, including imaging, molecular testing, and advanced pathology services are also crucial. So to conclude, engaging with you and other global partners in these potential areas, particularly focusing on capacity strengthening, can help improve cancer care in Ethiopia with much better outcome for our citizens, as the power of collective action and collaboration can accomplish a lot. Once again, thank you so much for this opportunity, and we look forward to a growing collaboration, and I wish you all a very productive and successful summit. I thank you.